Hello, welcome to this episode of Design Disruption. The COVID-19 pandemic has caused political, economic, and social disruptions that has given us an opportunity to build back better. In this series, The Design Disruption, which we've brought to you throughout last year, we've been hosting a series of dialogues on ideas to build back better, on how to make our architecture and built environment to build a more livable, sustainable, and equitable society. And we are so thrilled to bring this to you in collaboration with ArchDaily. I'm Prathima Manohar, and I'm so thrilled to have this discussion with you today, along with my colleague Sam Lubell. Sam?
Thanks, Prathima. Good to see you as always. I think we've been now doing this show for almost about, I think it's about a year now, if not more. So happy around anniversary on the show. And we're thrilled to be talking with the firm CannonDesign. And the topic is healthcare, which, as we all know, is a really, really important one these days. But it's important to realize that this is even moving forward beyond COVID and into the wider world. This is a topic that's here to stay and that is impacting all of our lives, perhaps more than anything. And CannonDesign is a firm that's been involved with healthcare for about 60 to 70 years. So they have incredible experience. They work on healthcare projects all across the world. And we have two members from the firm. We have Mike Pukszta, who's the director of CannonDesign's health practice. And we have Allison Mendez, who's associate vice president and an architect at CannonDesign. We're really thrilled to have both of you today. And why don't we first of all, hello, and hope you guys I think you guys are both in St. Louis right now. Is that correct?
Correct.
And,
good morning.
And maybe good morning and good afternoon, and all the way through the time zones. But tell us a little bit about yourselves and a little bit about CannonDesign before we get started.
Oh, sure. So I'll lead it off. So again, I'm Mike Pukszta. So I spend most of my time these days kind of assisting healthcare clients around the world with thinking about capital investments and thinking about capital investments post-COVID too. So a lot of what the work we do is involved with everything from small community hospitals to clinics to physician practices to academic medical centers to quaternary medical centers. And it's been work that we've been doing for quite some time. The firm CannonDesign, we're 105 years old. So we're an old firm. We started as an architecture engineering firm. Now we kind of think of ourselves as architecture, engineering, and design consultancy. So we've added a lot of great capacities over the last 20 years of clinical staff and operational staff and MBAs and MHAs and all kinds of different people so that we can provide more robust solutions to our clients. And it puts us in an exciting spot, especially these days when our clients have a lot of questions, some of them having to do with buildings and some of them not.
Excellent.
And I've been with Cannon for about 9 years now. And unlike Mike, I am not a healthcare expert, but I have done a lot of work in healthcare. I'm one of the lead designers from our St. Louis office, and I also teach design and architecture at Washington University in St. Louis. So I dabble in the academic side of things too. So if I get academic, just blame that. But my role is to be across disciplines, but we have a lot of healthcare work, so I've worked a lot in healthcare, but really to bring fresh design ideas from any typology into healthcare and into the other work that we do. So it's a really fun and exciting job.
Allison and Mike, thank you so much for joining us this evening for me here in India. And I know it's early morning for all of you in the US. And like Sam said, this is the topic of the moment. And I know COVID has disrupted multiple systems, but it's really highlighted the deep-seated weaknesses in our health systems across the world, and it has put unparalleled strain on healthcare infrastructure worldwide. And I know we are still in midst of the pandemic, but Mike, I want to ask you about, and I know you've designed so many healthcare facilities throughout your career. How has this pandemic changed your approach to designing healthcare spaces?
Yeah, it's a great question. It's one we're asked often, especially as we're working with clients both here and abroad that are saying, how is the pandemic going to change the buildings that we're designing? And even things that, are in mid-design, we're being asked, do we need to change things? And I love this little infographic here. This is from my friends at, I just forgot the name of the website. Oh, Visual Capitalist, sorry. It puts this a little bit in perspective that if you look on the left, this shows all the pandemics that we know in modern history, and the size of the little icon there is the size of people, the number of people that have actually passed away. Right in the middle of the circle, that's actually the one we're surviving right now, COVID-19. So in the world of pandemics, COVID-19 is barely even in the top 10. And the graphic on the right is one I think is interesting too, because it puts it over time. So if the things that are right in the front is today, so you see COVID-19 again there, right smack in the front and the bottom, and then it goes to HIV and AIDS and smallpox and things like that. If you click a couple times on here, the thing that I like to think about is, the last time we had a major pandemic that influenced our healthcare buildings was the Spanish flu. That was 100 years ago. And in the last 100 years, if we were to have redesigned every building to accommodate Spanish flu, which also had this, airborne particle transmission, we would have designed buildings to accommodate the Spanish flu. We would have used those for 50 years. We would have thrown those away. We would have designed another building to accommodate, airborne, and then we would have thrown those away because that was 100 years ago. So I think this is going to change everything. Mentality about healthcare design is not quite true, but it certainly is true that there's some very significant things we need to pay attention to as it relates to healthcare design. And so a lot of it has to do more with systems necessarily than buildings. So what we're really looking at is something I kind of call elasticity, that our healthcare systems, they need to grow and they need to shrink as demand changes. And the demand, could be a pandemic. The demand could be some mass casualty event, like just happened down in Miami, although there weren't many casualties for that one that hit healthcare systems. It could be, any number of certain events. Pandemics are just one of them. So, as we think about designing systems and designing healthcare, we often start to think about what are the kind of capacities for elasticity? How can we grow in areas where there's increased demand, or in times when there's increased demand? How much of that growth actually has to happen in a hospital? There's certain things that, we do that say, many of these things should not even come to a hospital. We need to create pop-up locations, or we need as a society to have other answers that doesn't drive everyone to a hospital that only has so much capacity. And it's pretty clear we can't, design a healthcare system for the next pandemic that's sized in a way to manage an event that could happen in 100 years, could happen in 50 years, could happen in next year. We simply don't know that, but it's unrealistic to say we're going to kind of resize our entire healthcare system for the next pandemic, because that's not a very good way to spend our resources. So, we talk a lot to our clients about, we do need probably some more robust engineering systems that have the ability to accommodate different demands over time. We need changes in our just-in-time supply network, because that was part of the real challenge about the pandemic, was not necessarily the buildings and the people. It was we couldn't get the supplies to people because everything is just in time and everyone only carries a certain amount of inventory. And that was one of the huge problems we had. So I think, as we start looking at the impact of the pandemic on our future healthcare buildings, I think it has more to do with conversations about how we can change demand over time without necessarily having to double the size of what we have today going into the future.
Right. So obviously, it seems in a lot of ways it's changing our approach more than it's changing into general health than it is changing specifically for COVID, because obviously there's a lot of other things that we need to be prepared for. And Allison, one of the things that I've noticed about the response to COVID as well is it's sort of accentuated trends that were already developing. So you have things like telehealth, which is something that had already started going before the pandemic, but now just like, everything virtual is now much more accepted and important. So maybe you can talk a little bit about how the pandemic has affected things like, as far as technologies, telehealth and other technologies that we're now using.
Yeah, I was going to say we're so much more comfortable with this, and I say this as I can see my screen lagging, and I might get kicked off again, and if I do, we haven't totally smoothed this out.
Yes, not a perfect thing.
But even so, if we did this a year ago, I think I would have been much more uncomfortable with it, and I think that's true for patients' experience with their doctors. And just generally, I find that we are becoming more comfortable with these types of remote relationships, and so they might not appear exactly how we think they're going to, and that's what's interesting to observe this in real time. What we're finding is the ability to collaborate is maybe more essential than the ability to see your doctor remotely, or one of the opportunities we're finding and trying to tap into for, hopefully someday when we're post-pandemic, that we can still have this amazing connection globally that doesn't require people to, always get in an airplane and fly somewhere. So what we're finding is, even though a lot of times the patient still wants to and still needs to come in and be physically seen, but now you can start to actually maybe connect with other doctors and caregivers across a larger network and get input in real time. So I think there's a lot of exciting opportunity in that, that will maybe have some subtle shaping of the built environment, but also the way we interact with our clients, the way we design. We're always trying to be more inclusive, get more diversity of thought. And that's all a lot easier now too, knowing that we don't need everyone in the room at the same time. So I think those are, trying to look at silver linings to a really tough year. Those are some exciting things that are coming from it that I do think will shape our built environment.
Right, and this is a question for both of you. Are there specific projects where this is really being built in that you guys are working on?
Yeah, I think the cool thing the pandemic actually has done for healthcare is my experience with healthcare is that they don't embrace technology to the point other industries do. And a lot of it has to do with, chain of custody of data and HIPAA compliance and all kinds of things. But what the pandemic has done is actually just shattered that. And so all of a sudden, our clients now are embracing technology in a way they haven't before and embracing it the way other industries have embraced it. And there's, I guess there's a couple little exhibits, right here that, as we're talking to our clients now, we're actually able to curate the patient's experience using technology in new ways, so here really talking about our clients, our patients of our clients, really interacting with our institution digitally before they even arrive. If you go to the next one, really start to think about, the actual event of seeing a physician might not be in person the first time, second time, may never be in person. But maybe more digital, and the idea that could we even think about like the airplane industry, exactly what time you're arriving? Could we push all the appointments right to somebody's phone? Could we give them the ability to arrive in some way that's much more elegant? Whether it's like a valet parking, or even think about, could we assign a parking spot to them so the second they arrive, they know that they parking spot 103 is assigned to them. That's like the number one thing in healthcare is my parking spot is how can I even find parking? We've designed facilities that have no reception desks and are just purely greeted by patients like the Apple Store, where people are concierge, kind of looking for you if you have a need. And then especially, the ability to actually track people and to track activities in healthcare, that's huge. There's literally a hospital has thousands of staff, thousands of patients, and trying to make systems work perfectly. If you kind of know where they are, you can make this work. And so there's badges now and things, technology that lets you track literally where everything is. And the cool thing that does, it lets patients like even think I can sit anywhere. I don't have to necessarily sit next to a door and wait for somebody to say, Mike, you're up next. I can have a seat in a great lounge. I can, if my doctor's running late, they can push something to my phone and say, Dr. Smith's running late. Feel free to go get a cappuccino. The technology exists for the people to know in a hospital exactly where everything is at any point, so they can keep operations running, they can keep the chain of activities going perfectly. Really encouraging people to interact with technology in exam rooms is really important. Being able to greet patients and be able to not treat people as numbers, but use technology to actually enhance care is actually so important. So I think this is a really cool thing, as we're really talking about how do we improve healthcare and how do we use technology in a way to improve healthcare. And we're all so comfortable with technology now because of the pandemic, and patients are comfortable with technology no matter what age, that all of a sudden it becomes a question about, how can we best use technology, which is just a really cool thing that I think has allowed us to do some really breakthroughs in terms of how you interact and how you experience healthcare.
Yeah, it's interesting that, technology has reached such an amazing level, and there's so many ways that it can help us as far as treatment of people, as far as changing the dynamic inside the hospital. And yet the things that people technology-wise want to change the most are like, parking spaces and how long they wait in line at the, to see their doctor. So there's still some basics that we need to take care of too.
Yeah, absolutely.
So Prathima, I think you had a question on mental health.
I think, Sam, you're right. I think, this pandemic has kind of, reminded all of us about how stressful it is to be in a hospital. And I think stress of hospitalization, can have an impact on your physical, intellectual, and psychological function as a caregiver. And obviously there's so much of pressure on the healthcare workers that we are seeing on our TV screens now. So I want to ask you, and maybe Mike, you can lead with this. How can design and architecture contribute to, the mental well-being of the users of these spaces?
Yeah, that's so important, and I think Allison and I are going to tag team at this a bit, because this is an area that we are diving into right now. And that again, if there's something good that's come out of the pandemic, it's actually recognizing that mental and behavioral health is really important, because everyone has kind of experienced different ups and downs over the course of the last year and a half, and it's becoming socially acceptable now to have ups and downs. And we're really kind of moving into an era where mental behavioral health used to be a stigma. Now it's no longer a stigma, and it's going to put different kind of pressures on our health system to actually provide probably more capacity than what we've even had before. And Allison's done some really fantastic work kind of looking at this, and especially what it means not only to adults, but to pediatrics and adolescents. And then some of the things that we're looking at, in terms of facility design.
Yeah, I'll tag on to this, because this is one that I'm super passionate about. And, although I'm not the healthcare expert, very intentionally I've been brought into projects without that expertise to rethink environments for caregivers. And that was something we started seeing a trend towards before the pandemic, but then it became, I think, like the technology piece, it was something people were willing to talk about and explore, because that burnout is very real and it's happening. But then this really shot it to the front and said that this is a major, major issue. And so we've started to see a lot more investment in the caregivers themselves, so the staff in the hospital, which was so essential during these last few months, years. We're now into over a year. And so I had the chance to see a project where that was a big investment that we had done right before the pandemic, and when all other caregivers were experiencing massive burnout. That intervention and creating those spaces of respite for the caregivers had an enormous impact to those individuals, especially compared to just kind of that onslaught that was happening across hospital systems. But what we're finding is it's you have to meet people where they are in so many ways, metaphorically and physically and literally. So it's trying to branch out from the image that was being shared was actually an inpatient. So we do a lot of inpatient facilities, And we've learned amazing things from these inpatient facilities, like this diagram. We have more, it's not just the space for the staff, but more supplies sort of focused on in the center of this plan. And then you really spread the people, including staff officing, kind of out along the south perimeter there, the bottom of that page. The inpatients are kind of up along those skinnier legs. And then you can see from that diagram to the right, or that site plan to the right, really nestled into a landscape. So these are things we've been exploring, and concepts that, frankly, aren't disruptive or new in inpatient, but we have really nailed down, I think, creating these wonderful environments for inpatients. And now we're saying, how do we take that same great insight that we have for behavioral health inpatient and start to deploy that across many different building typologies? So it might not be, it might be in a hospital, it might not. So starting to reach people who are having mental health crisis before they're in the inpatient, because that's not where the crisis happens. It happens before. And now we're, with people stuck at home, you really have to reach out. You can't wait for people to come to you.
That's fascinating. Just, I think we as a society it's one of the many side effects of positive side effects of COVID is just, being more aware of our own wellness and mental health. And as you said, trying to address it earlier, not waiting until people are, in acute mental distress, but working on that a lot earlier. And we've all had to deal with some level of mental distress during this pandemic. So it's just been something that we're dealing with in I think more effective ways and discussing this more openly. And another kind of branch of mental health is just the idea of wellness, and the idea that everybody needs a better environment to heal themselves mentally, to heal themselves physically. And it doesn't just mean taking a lot of medicines and waiting to the last stage of poor health. And I think hospitals for a long time have addressed this, and I'll share my screen, which is always a challenge and brings me mental health issues whenever I try to do this. But Prathima, let's try to share my screen if we can do that.
Yeah.
Did that work?
Yes.
Okay, great. So these are just a couple of examples of sort of addressing wellness through biophilia, which is including more plants, more natural light, more of nature, because it's obviously more and more being proven to be a healing factor. This is an older project in Monterey by Edward Durrell Stone, the community hospital of the Monterey Peninsula, project I've been to, and really is a healing environment. As soon as you walk in, you feel calmer, you feel the natural light, you feel the trees. There are, you see the water, and you're just sort of enveloped in nature. Obviously, you're in Monterey, that doesn't hurt. But and this is a project by Rim Gym in Singapore, and just really, adapting natural elements that really are healing. And if you're in a hospital, I can't think of a much more stressful place to be. And I think it makes you sicker in a lot of cases because you're feeling stressed and you're feeling like you're in an environment that's sterile and not there to heal you. And this is a project in Finland, which uses all natural materials to build the hospital. So timber framing, timber exterior, a lot of glass, and a courtyard with a garden in the middle. So those are just a couple of examples. Obviously, there's a lot more. So I'm curious what specifically you guys are looking at as far as biophilia and really changing that wellness dynamic inside hospitals.
Yeah, I think we have a pretty good selection of images we selected today. You hit on this earlier that biophilia is not new. It's getting some renewed attention, which is great. I like to think of it an even bigger picture. I think connection to nature is really important, but also your connection to your place. So I really kind of get nerdy about like phenomenology. That's something I'm super interested in. It's very fuzzy and squishy. So some of the other academics might not think it's quite defined enough. But I really like thinking about a sense of place and really the experience of someone in the place. So it's not just that you're bringing green, whatever that means, or nature in, but you're creating an experience for the individuals in the space. And so, for instance, this is a project that our St. Louis office and Buffalo office worked on, where we had an existing building for behavioral health, and we had this fantastic atrium. And it's very difficult to do these types of environments in healthcare, but lots of kind of sustained energy on the patient spaces for inpatient behavioral health, having access to this. And we can kind of just quickly, I think, flip through a few examples of this. But, just bringing in that. So that's not, it's not a water feature. It's just a material that starts to do that. So starting to, again, kind of create those connections to natural elements, even if they're not nature themselves. And I think, again, it's also about creating that sense of place. So this atrium is a landmark. So when you're feeling lost, which, who doesn't feel lost in a hospital? And I think, feeling lost in a kind of inpatient behavioral environment would be very frightening. It's not only providing you a green space, it's providing you an orientation. So that's what I think is really interesting. And I hope another thing that comes out of this experience is having a lot more empathy for the people we design for. So thinking about what that lived experience feels like and what would we hope for in those moments, and those moments of reprieve and of respite and some comfort, which we know that is very studied. We do know we get that from nature. We do know that, indoor air quality is improved by having vegetation in a space. Again, very challenging sometimes with healthcare, but there are a lot of ways to create those connections, even just through large views. So if we maybe flip through a few more images very quickly to see all the different ways we're thinking about it. This is, Mike can speak much more to this project, but it's a huge project, CHUM in Montreal, and just absolutely huge on the skyline. And so how do you create
I think we lost Allison for a second. So, Mike, I think maybe you want to pick up from
Sure, I can pick up. That's
pick
great.
Up the baton.
Yeah. So as Allison said, this is one of the biggest healthcare projects that has been done in North America in a decade. It's like if you have $3 billion to spend to create a mega institution in the middle of a city, how do you incorporate biophilia and nature into this when it's just this dense urban environment? And we did it in many ways. Here you can begin to see this as a view from a patient room down. So the flower that you see down below, that's actually a green roof garden. The materials and the plants we use there are plants that are actually used in making medicine. And, we organize the green roof in a way that, it actually looks like nature. And whether you're up above or looking out at the ground floor, it starts bringing nature even into this massive urban area. So there's ways that we can, start involving nature and bringing nature in unique ways, even in the middle of dense areas. And I think if you go to the next one, the other piece that, we often take advantage of as best we can is when you have a beautiful setting. This is Mount Sinai and Miami Beach. And, we're fortunate we just had waterfront setting. Not many hospitals do. So this was the site of a lifetime for an architect. But, as we did this patient tower you see in the middle, we really wanted to take advantage of the views. So we literally curved the facade of the building in a way that maximized every view of this building, out to the bay and out to the Miami skyline. So if you go to the next couple slides, you begin to see all the patient rooms or, waterfront views. And again, there's a lot of evidence in healthcare that, views to nature, reduce stress, improve healing, reduce length of stay, reduce pain medications. There's all kinds of evidence in that. And, so even as we start thinking about, a building like this, even this is an interesting one, even where we couldn't, not every single view in a hospital can face one way. So even when we couldn't face this spectacular view, we kind of curated views and, created nature within the building where we could, focus some views onto natural areas that we created. And so this is probably my prime example about, how do you really start thinking about taking advantage of your setting when you have a setting like this. One other one here, just to share, this is at a much smaller scale. So this is a radiation oncology center in California for Kaiser. And you can probably barely see it, but even the frit pattern in the glass here was trying to embrace nature. So those are actually trees that are in the frit pattern. And so the outside of the building, really starts to become something that is intended to be calming and intended to be, filled with nature, even if it's kind of artificial nature, because we're in the middle of kind of a suburbia here in Anaheim. But when you go in the building, one of the most challenging spaces to design as an architect is this room, which is radiation therapy. That big machine on the left is where you go for cancer treatment, and that thing shoots electrons at you at megavolts, and it's the most terrifying machine in healthcare. I mean, if you have cancer and you have to get radiation therapy, this is probably the scariest room in the world to come into. But what we were able to do here, and this room has like 8 feet of concrete all the way around it and above it, just to protect the rest of the environment from what's being shot at the patient. Here we're even able, through some really creative engineering, to get outside light and courtyard in that building, even in the space that is impossible to do. So I think we're really seeing a lot of our clients in the industry really pay a lot of attention to biophilia, healing design, and the healing aspects of nature in healthcare. And it's something that we just need to, as professionals, I think, take every opportunity we can to figure out ways to leverage this great tool we have, because quite frankly, it's free, and we haven't leveraged it as a profession very much until now.
I really love the idea that, you don't necessarily just need to fill your hospital with plants, and in some cases hospitals won't even allow that. We got a comment from somebody in the UK mentioning that, but you can bring it in. So much is about what you can bring in from the outside, borrowing space, borrowing nature from outside, cues that are natural, that like you showed some of those some of the designs on the walls and this sort of natural light that comes in. So there's a lot of creative ways to be natural without just sort of having to, although obviously we love to have water and plants everywhere. That'd be the more we can do that, the better. But there are other alternatives as well. I love that.
Yeah, there's actually some unique thing called embalmed plants that are actually real plants that go through an embalming process, so they don't give off any kind of challenging diseases that could be borne by plants and water and mold and things like that are growing. And so the point is really good, that bringing nature into healthcare sometimes is challenging. And I've even had a client where we've had an outside courtyard, and they wouldn't allow natural plants in an outside courtyard. So we had to use artificial embalmed plants in an outside courtyard. So sometimes the infection control people get a little bit crazy on us, but certainly, trying to find ways to create and curate or take advantage of natural views is so important to what we're doing.
Now I've learned a new term, embalmed plants. Thank you.
Embalmed plants.
And I love to see the spaces of care and spaces of healing. And I know all of us have been bombarded with images of hospitals all through the year. So it would be nice to see more of these kind of spaces as hospitals in the future. Thanks, Mike and Allison, for sharing that. I want to talk a little bit about the broader kind of aspect of healthcare infrastructure. I think it's become more pressing than ever for countries to, identify their healthcare infrastructure gaps and deliver that promise of health coverage for all. So I want to speak a little bit about planning for, future healthcare infrastructure, especially in places like India, where there's a huge gap. And when we think about building that, healthcare infrastructure for the future, what should it look like at the metropolitan or urban level? And I know you've done a ton of work also on modular design and construction in healthcare infrastructure. Can you speak to us a little bit about how some of these factors can help scale up development of affordable health infrastructure in economies that now have this opportunity to invest in healthcare, and it's not it's much needed. How can we do it right? Mike, do you want to have a go at
Yeah,
that?
let me, I think your question scared off Allison, so I guess I'll take that one. I guess there's two different scales I'll answer that at. And this is something that I think the world is finally embracing, that health does not equal healthcare.
Right.
To be healthy and to have a healthy society actually has little to do with having good hospitals. And if you think about what the factors that influence health, some of it is genetics, some of it is your environment, some of it is your access to care, some of it is just your lifestyle and eating healthy and remaining healthy and all those kind of things. And if you kind of look at health in its entirety, having a great healthcare system and great hospitals doesn't necessarily mean you can create a healthy environment and you can create health. And so when we really look at kind of societal changes and things we need to really start promoting, it's not necessarily building bigger hospitals. Quite frankly, we probably want to build smaller hospitals, and we'd rather start to take advantage of improving health so that people don't actually get to the point where so many need hospitals for the wrong reasons. So we're kind of promoting an idea. Within our practice, we have really a concept called living centered design. And it's really kind of promoting living through great design. And that's not designing better hospitals, but it's really designing better environments and thinking carefully. And even within our K-12 and education systems, we do a lot of work in that space. And it's really trying to encourage conversations and education around health, because an investment in education around health will go 100 times further than an investment in a better OR. And so as we look at developing countries, as we look at even our own country, the investments that we make actually are almost backwards. If you look at the United States, we invest 95% of our health investment is actually trying to create new cures and not necessarily prevent disease. And until we start flipping that diagram around and start investing more in how do we, prevent disease, not necessarily meaning cures, but how do we keep people healthy, we're just going to be doing the same thing. We're going to be continually investing in hospitals and investing in technology, and that's actually probably the wrong thing to do. So it's a bigger societal question, but I think as we getting it back to buildings, as we start thinking about buildings, often we start just putting some pure metrics out there. Like in North America, we spend trillions of dollars in healthcare. The amount we spend in healthcare construction is usually only 1 or 2% of that. But within that investment in healthcare construction usually gives us the ability to have conversations that are bigger. So before we have a conversation with a client about spending, $500 million on a building, we say, is this really the best place to put your money? And can we actually think about, spending this in a different way where we don't necessarily need as big of a building? So I think a lot of those conversations are finally starting to mature and starting to get a little bit more robust now that we have better data and we have, more people interested in health than healthcare. But to get a little bit more granular, you talked a little bit about ways that we can build better infrastructure and the disruption, even the title of today, we need disruption in our construction environment. And, we've been building buildings the same way for, generations, if not thousands of years. It's like one brick at a time, one stick at a time. And that's how we've been building buildings forever. And it's probably not the most effective or the most efficient way to do it. So, what's shown here of just trying to think differently about how we actually invest, in this case, in hospitals. Can we actually prefabricate components of hospitals in a much healthier environment and safer environment at warehouse, where we've got ergonomics and we've got better health for our employees and better, work style for our employees? Can we actually create healthcare components like this? Can we actually ship them to a site and install them? And can we do that more effectively, more efficiently, save time, perhaps save cost? And I think we've proven, yes, we can. And it's a major disruption in our healthcare construction world these days of, really starting to think differently about, can we actually modularize healthcare to the point where, it is duplicative, because much of healthcare is just repeating the same rooms over and over again, whether they're exam rooms or patient rooms or ORs. And so if we starting to think about, a very duplicative environment, can we think about this differently? What's on the screen now is an investment LA County is making right now in a restorative health village. So this is actually kind of getting to both points. This is the county trying to really say, how can we help our behavioral and mental patients in a way where we're not putting them in a hospital? So this entire building is here to try to serve the needs, the challenging needs of our behavioral and mental patients, and do it in a way that is modular. So much of that building is actually being prefabricated in a factory in Kansas and sent to Los Angeles so that it can be stacked and it can be kind of inserted and created in a modular fashion in a way to prevent behavioral and mentally challenged individuals from actually entering a hospital. So here, I like this example because it's showing really two things. It's showing differently about where we need to make investments on a more of a preventative front than a curative front. And it's also doing it in a way that's incredibly economic and has great speed to market attributes. And so I think we just need to think differently about disrupting not only where we're making investments, but how we're making those investments.
Right. It really seems like the kind of capacity of doing prefab and modular and just a more kind of nimble construction really kind of lead you in the direction of, we can build hospitals quickly. And it's something we saw during COVID, people, building wards in days, in existing facilities, but in China and in Long Island, they built hospitals in a matter of weeks doing prefab, but also the ability to build just smaller clinics. So people are more, willing or more, it just seems like more of a neighborhood thing to go and see their doctor before they get sick and have to go to a larger hospital. So, is that something you guys are involved with, is smaller clinics or pop-up buildings or things that are just making health a little bit more accessible to people?
Yeah, I think there's probably, there's kind of two questions in there. The whole idea of pop-up and accessibility that really got stimulated by COVID more than anything, where we did need different kind of capacities and different kind of pop-ups. And certainly we've been using some of those, and are trying to debate now how much of those do we need in the future. But pop-up healthcare is certainly a thing to take care of some of these capacity constraints. And as I talk about, like creating elasticity within a system, our elasticity probably should be thinking about, where can we satisfy healthcare needs that isn't necessarily dragging everyone to our existing healthcare institutions, but having them take care of their needs in other places, and that some of those other places could and should be virtual. So we're not actually building buildings for things that could easily be taken care of, by a virtual visit. The other piece of this is, thinking differently about modular in a way where, some of our clients are actually challenging, should they even control the supply distribution system? And, why can't a hospital actually just go to a company and buy a whole bunch of, say, exam rooms and just ship them to a site and stack them up and install them? And so I think some of these disruptors you're beginning to see are kind of both focused in on how we do things as well as where we do things, and creating, instant. That's the challenge about healthcare is by the time you decide to make a capital investment and get it through leadership and get it through boards and get it all approved, generally you need that capacity online as soon as possible. Most of our clients are coming to us saying, can you help us design a building? By the way, it has to be open Thursday. So we have to start thinking of ways to do things quickly too. And this whole idea of prefabrication and modular certainly is a speed to market advantage.
Right. And Allison, I wanted to follow up with you because another major disruptor, besides kind of getting people out of the hospital, but when you're dealing with hospitals and all these spaces, is sort of getting out of the silos of what we're used to. So that can mean within a hospital merging disciplines like treatment and education and research and putting them all in the same place. But it can also mean bringing your own expertise in other realms of architecture into hospital design or medical design and vice versa. And I know that's something that you're very involved with, especially because you're not, as you mentioned, just a healthcare designer. So you can really bring expertise that is sort of outside of the general healthcare field.
Yeah, absolutely. And I apologize for, I keep dropping off this, but I will keep coming back.
You're just helping us demonstrate the challenges of technology.
Yes, that we're not quite there, but we're working on it. No, I think that one of the great things about our firm and the size of our firm is that we do have so many different markets that we thankfully have experts in. So we have a lot of generalists and a lot of experts. And I think, your previous comments about will healthcare happen in these big hospitals or will it happen in these kind of smaller, it's always going to be both. And so being able to reach out into your community with healthcare type facilities that are maybe embedded in something else, I think is really important. But similarly, like you mentioned, bringing in our other expertise. So we do lots of sports and rec buildings. We do lots of education buildings. And there's different things you learn from all of those. So, obviously sports and rec gives us a fantastic crossover to anything that has to do with rehab, or really just getting people more physically active, which is hugely beneficial to health. So I think there's really exciting opportunities to start breaking down. Okay, you're an expert in this. Again, even with behavioral health, start bringing behavioral health experts into other zones where they can really start to shape all of our environments. Because I think what we really want to get to is the everyday for people and helping them in their everyday. So there's always going to be a need for hospitals, and we're always going to need those spaces to be really thoughtfully designed. But again, it's trying to think of that whole continuum of life and keeping people healthy, hopefully before they even go into the hospital, with these kind of amazing design techniques that we have from other building types.
I think this has been, such an important conversation to have at this moment. And I think, both of you kind of pointed out that we have to focus on preventative, health instead of just, thinking of building newer hospitals. And you've spoken to us about, really creating those spaces for healing. And I think that was a big takeaway for me. And before we go into the next segment, I want to take a moment to say hello to this amazing ArchDaily community that joins us through these conversations. And I can see that they're from around the world. So I want to encourage them to say hello to us. And if they have any questions for Mike or Allison, to share them with us on the comment box below. And we'll try to get Allison and Mike to answer some of your questions. Sam, should we go into the next segment, which is quick fire, and I can start?
Yeah, sure. Let's do that.
Okay. So this is something that we came up with because we want to know you a little bit more, the person behind the designer. So I'm going to start. We have a few questions, and you can, tell us your personal kind of choices, and it can be quick and fun. So my first question is, Allison, maybe you can start. What are the best and worst hospital you've been to?
Oh,
Might get a little bit more time to think about that.
Yeah, no, I don't. I'll describe them instead of naming names. But one of the best ones actually is quite old. It needed a ton of work, but it just had all of these amazing courtyards and amazing views of an ocean. So the architecture was actually just quite good at creating an environment where you always had that sense of place and just really great views. Worst hospital, probably where you are completely embedded and so lost in a maze of hallways, and you can't tell where you are anymore because everything is just big and massive. So that's more describing what they look like than what they are.
Mike, do you want to take a shot at that?
Yeah, that's a hard one, and I'll take Allison. Same. I'm probably not going to name the name here, but I would say some of the best hospitals I've been to are ones that, quite frankly, don't look like a hospital. I think there's this kind of preconceived notion of what does healthcare look like, and it has to be functional, and it has to be green and ugly and sterile. And I think some of the best work that's been done are facilities that when you walk in, you're just like, this doesn't even feel like healthcare. It feels like something very different. And the reason I like that is because, when you enter a healthcare environment, for 99% of people, number one, you don't want to be there. That's actually the challenge of doing what Allison and I do, is we're designing buildings that nobody wants to go to, unless possibly if you're having a baby. Other than that, you don't want to go here. So, it's almost like hospitals and prisons both fall into that category. But, so when you walk in, you feel like you don't want to be there. It's uncomfortable. It's not normal. And you're not comfortable kind of interacting with your care provider. So honestly, the hospitals that don't look like hospitals make you probably more comfortable to have your healthcare provider be your partner. That's why I like them. So I'd say the opposite of that. The ones that I think are probably the worst are the ones that, have just kind of picked up, well, the hospital stereotype. It has to be XYZ. It has to be a whole bunch of little rooms and circulation that no one can find and no windows and, absolutely clinical and sterile. And once you start, entering into an environment like that, I think you've kind of missed the reinvention of the building type that most people are trying to promote.
That's a great answer.
Those are great. Thank you.
Sam, do you want to name your worst and best hospital?
Okay.
No.
I think I agree with both of these folks on the best and worst. I think having spent some time in hospitals, the ones that make you feel kind of connected to the outside as much as possible and not stuck inside, and the ones that make you understand where you are and not feel lost, because you don't want a place. You're going to a place that's designed to heal you. You don't want a place that's going to make you feel worse mentally. And I really don't think there's a distinction between mental and physical health. I think if you're feeling mentally poor, you're going to feel physically poor and vice versa. So I think hospitals, the more they take that into consideration, the better. And I have a question, which is, and you guys work mostly in North America, but you work worldwide as a firm. And I'm wondering if you have an opinion on which country has, to you, the most effective healthcare infrastructure.
Wow. That's a challenging one. Actually, there's a couple answers. I think what some of the work being done in, I'm just going to call it in Europe, kind of generically, I think is really interesting, just because of the public health system and the ability to kind of think differently about where you're making investments and not overbuild in one spot and underbuild in another spot. I like the consistency of what's happening there, and I'm going to go up to our friends in Canada too, north of the border as well, because Canada's been doing a massive redevelopment of their entire healthcare system across the whole country over the last 10 to 20 years, using P3 as its primary vehicle. But it's really, I think, given them the ability to think differently about, what does the population need, align the facility needs with that, do it in a fashion that is publicly funded. So, there's no extravagance in terms of how to spend money, but you look at their new facilities and they're relatively extravagant. And I say that in a good way, meaning extravagant in the way they've really been thoughtful about how to spend dollars wisely and invest them in the right things, invest them for the long term. And, and even promoting P3, you're trying to invest in a hospital that has to last for 30 years. And the quality materials, the quality construction is actually really good. So I like a lot of what's happening with the Canadian infrastructure investments, and it's really taking lessons learned that from Europe about 15 or 20 years ago.
Allison?
So I'm not the expert on healthcare, so I defer to Mike. But I also would say, whenever I'm looking for some inspiration on how people might be doing a little different, I always look to the Nordic countries. They make beautiful architecture, and they seem to have some really good opinions about how to do these types of buildings. Yeah,
there's always even when the buildings are very modern, there's always a respect for nature. I think that sort of a humanism to those designs, and that's not an easy task, is to make an environment that's so clinical by necessity feel human. Prathima, I wanted to ask you, because you're in India now. I mean, and we've heard in general that there's sadly a lot of issues going, obviously, with COVID, but what to you are the strengths and maybe the weaknesses of the healthcare infrastructure where you are?
I think COVID really revealed how big the gap is in terms of healthcare infrastructure, especially in rural areas, and even in places like Delhi. And I think I don't think any healthcare system could have been designed for a pandemic where you had so many people getting sick at the same time. And I was just reading a headline on one of the magazines saying, to kind of tackle the pandemic before it becomes a pandemic is much more cheaper than dealing with what we are dealing with right now. But yeah, I think I think we have to kind of discuss this question on how to think about health as a society a lot more. And I think I think Mike's points of creating healthier urban systems and societies is so much more crucial than just building high-tech health infrastructure. As you know, India is one of the kind of hubs for medical tourism. In the village that I'm at, where Manipal is, which is a little town, it's an education university town where the CEO of both Google and Microsoft, went to school in. It's a kind of a tech engineering school, and there's a huge high-tech hospital, but that doesn't really solve the problem of creating a healthy population of 1.2 billion people. So I think this pandemic, hopefully pushes our policymakers and all of us to think more about what we want for a healthy and happier kind of society.
Yeah, I think it really brings up just quickly. Sorry, the question of equity in health and the fact that we are making incredible strides, but we can't leave behind certain communities, whether that be in our own country or in countries that are developing. And I think that does take the cooperation. Mike, you were saying public-private partnerships. It takes the cooperation on a broader level. You can't just depend on private companies to necessarily fix this problem because they're worried about their bottom lines. And so you have to really have a kind of a broader discussion to change that sort of equity question when it comes to healthcare.
Yeah, that's actually really. I had an experience just before the pandemic. There's a group called the Advisory Board that just half or three-quarters of the hospitals in the United States belong to this group. And, they provide a lot of thought leadership in terms of where healthcare is going and future thinking, and they have annual conferences. And so I've been attending their conferences for years. The last conference they did, I thought was really interesting because usually it's, a couple speakers and hundreds of people in the audience, and it's just didactic and you're listening. During this one, they actually said, okay, we want all the audience to get in groups of 5. And they've never done this before. So I was like, what is going on? This is really weird. I have to actually talk to the person next to me, which I thought was strange. So we all got in little groups of 5. And the speaker said, okay, we're going to give you 15 minutes to solve a huge healthcare problem. And we want you just to kind of think about it, talk about it, and figure out what the solution is. And so everyone got in their groups. Okay, what's the problem? They said, solve poverty. And it caused everyone to stop because these are a whole bunch of hospital administrators and leaders that were in the room. I mean, I was sitting next to the president of a hospital and a couple of executives, and we all just looked at each other. And I thought it was fantastic because people then were talking about how can they, as a hospital, what can they do to help solve poverty? And it started getting into the inequities of healthcare, and it started getting at kind of the real root of health, that actually, if we can solve poverty, we can do an amazing job of improving health. And so I thought just like institutions like that, asking that question, I think was fantastic. And that's where I'm hearing things now. I've obviously been doing this for several decades, but I'm hearing things now that are making me believe we're starting to ask the right questions. And I think we were asking the wrong questions before, and I think we're starting to ask the right questions now.
Yeah.
Really, really good point.
I know Allison went away again. I think she's having more tech troubles. But Sam, do you want to do this sketch? I know Mike has to leave in a couple of minutes.
Mike, if you have time, we can quickly try to do a sketch. Yeah.
Yes.
Well,
So
as
as
long
part
as
of
you don't laugh at my drawing ability.
yes.
Oh no, mine's going to be worse. Trust me.
So this is something that we've been doing all of last year, which is getting all of you to kind of sketch up your vision for the future of built environment. And I'm going to ask both of you to draw a perfect place for healing. And as you do that, I'm going to... And did you get your sketch pads and pens in
Well,
place?
given my drawing ability, it's not going to be perfect, but that's another.
Yes. I'm going to read out a few audience comments while you, sketch out your ideas. So Michael here is, he has a long comment, and he's saying, Doc, the box is great if we can get to Walmart pricing. We've not found a way to reduce USA costs to the world norm and drive up quality outcomes. We need population health, which is preventive care at costs that match or beat Asia or Europe, with healthcare outcomes in the top 5%. I've seen rankings put the USA at 37. Perhaps this is outside the scope of architecture, but how can we reduce the costs in healthcare? We've heard about those scary stories out of US of how you would go bankrupt even if you're a millionaire if you had cancer. So I get that question. We will get Mike to maybe take that one once the sketch is over. But I'm sure it's a bigger policy and economic question in the US. Susan Yen says, yes, we need more smaller and authentic consultation and prevention-focused centers. Thanks, Susan.
Yeah, just to weigh in a little bit, I'm done with my little sketch, but
you are okay.
I think the point
Michael,
about
I know Sam's still sketching, so do you want to take that question from Michael about how do you drive down costs and increase outcomes?
The point is a great one. I mean, you look at the economics of healthcare and how the U.S. Invests the most in healthcare of any nation, and our outcomes are amongst the worst. And there's just no question. I mean, you can measure it any way you want and cut it any way you want, but we are not at the top. And I think there's been a lot of debate about, it gets back to my question about like where are we investing our money? And if you look at like how much money we're investing, we're all investing it in curative things and not as much in prevention. And I think that's one of the fundamental challenges. But there is just no question that we as a U.S. society are over-investing our GMP in healthcare compared to the kind of results that we're getting out of it. And in almost any other industry, you'd have somebody looking at you going, you're not getting the kind of results and that kind of investment. But the challenge we have is the U.S. healthcare is just an amazing cottage industry. I mean, it's not necessarily government based, although government funds 50% of healthcare. But just trying to make a major impact in an industry where there's literally hundreds of thousands of businesses that make up healthcare. It's really challenging to take this big ship and turn it in a different direction. But I don't disagree at all, and the data is there that just suggests pouring more money into it isn't necessarily going to get us better results, because we've been doing that and our results are not necessarily better. I'll share my little sketch with you. This is pathetic. And of course, our designer drops off just as you kind of make a sketch. But so my little sketch is actually the things we've been talking about. It's, it's me and nature, and the place to heal is actually probably not inside a building, although otherwise I do have a little building here.
I love it.
But I would say, if I wanted to kind of create the perfect healing spot, it's probably something that just embraces all the concepts we've really talked about today, and says I actually don't want to get sick to begin with, and if I should have drawn me running, which I wasn't smart enough to do, but if I can stay healthy, then I wouldn't even have to answer your question and where I'd want to heal.
I love it. That's
I think that's a good message. Preventative healthcare and also kind of ode to nature to create places of healing. Thanks, Mike. Sam, do you want to share yours?
Sure. Happy to make yours look a lot better. I thought yours was great. So this was me, not a 10-year-old. But the idea is simply, so this is a tropical resort, and those are the cabanas closest to us. Those cabanas that everybody pays like $500 a day to sit in and just drink champagne. So instead of people drinking champagne, this is where people who are sick go to heal. They just get to sit in the cabana, look at the pool, nature, the ocean, and they don't have to use the champagne, but they have facilities if they need them. And to me, that would be a great. You can replace all those resorts with healing facilities. I think it'd be good for a lot of people.
Yeah, we have those here in India with Ayurveda and yoga. So that sounds like how we did it in the past.
Yes. Yeah.
Oh my God, this was a great conversation. Mike and Allison, thank you so much for sharing these insights. And it was, it's a tough topic, and it's not buildings that anybody wants to be in, but it's very, very important. So thank you so much for sharing your thoughts with us. And I also want to thank the amazing community that joins us during these important conversations. Thank you so much. Thank you.
Thank you again, Mike and Allison. Sorry for the technical difficulties, but you guys were both really great. And I think this has been a really thought-provoking discussion. So thanks so much.
Well, thanks. Great forum. Thanks for inviting me.
Thank you.
Okay, thank you.
See you soon.